Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 475,214 confirmed cases of COVID-19 in Canada and 144,396 cases in Ontario. Chatham-Kent has 557 cases, and Sarnia-Lambton has reported 456 cases. Michigan now has 442,715 cases, with 23,672 cases being in Detroit. Today we are reporting 113 new cases of COVID-19 in Windsor and Essex County. 27 cases are related to outbreaks, 5 are contacts of confirmed cases, 2 are community acquired, and 79 are still under investigation. We have had 5,012 cases since March. 4,031 cases are now resolved, and 890 cases are active and being followed by our health unit. 57 confirmed cases are currently in the hospital, and 12 people are in ICU. In Windsor, there are 79 suspected cases of COVID-19 currently hospitalized. Our community has lost 91 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 24 active outbreaks in Windsor and Essex County, 8 in long-term care and retirement homes, 11 workplaces, 3 community outbreaks, 1 hospital, and an outbreak was declared at a new school today. The classes were already dismissed last week and are in isolation. In addition, 4 school cohorts, approximately 90 staff and students, were notified of school exposures this past week and are isolating. We continue to work with the school boards to appropriately notify people and provide isolation directions. So please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household. Keep a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors. Outdoors, if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID exposure app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. There are 3 testing and assessment centers in Windsor-Essex, Windsor Regional Hospital Olette Campus, Windsor Regional Hospital Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechew.org for further information and updates. Please note that there are delays at this time due to the volume of the cases and data entry of these cases. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I'll start the day with a positive note. I want to thank Valentina from Notre Dame School for sending me this wonderful letter, and I want to read this letter. Dear Dr. Wajid Ahmed, I am writing to you from Notre Dame Catholic Elementary School in Windsor. I just wanted to let you know how much I appreciate how much you are doing. I am thankful for the sacrifices that you made for me, my family, and my friends. Thank you for working these tough times. People should not be rude to you. You are just doing your job. You do not deserve the hate. Remember, you are great, and do not listen to any hateful words. Are the cases going up or down? Unfortunately, cases are going up. How do you feel when you read how many cases there are? It really feels bad. It makes me sad. Are you scared? Partly yes, because things are getting worse. And he continues on with writing, I wish you all well. I hope that COVID nightmare is over soon. Take care, and I wish you a Merry Christmas. And he even wrote a Santa for me. So thank you, Valentina. And I believe this is he's trying to put a picture of me standing and reading these cases. So thank you again. I really appreciate this. Messages like these definitely make our day, make us put a smile on our face, and give us the motivation and energy to keep us doing our best to manage this pandemic. So thank you again. All right, getting down to our pandemic situation. Today we crossed another milestone with 5,000 cases in our region. As I've shared it before, it took us 25 days to report 1,000 case, from reaching from 3,000 to 4,000 mark, and this time it took only 10 days to report the additional 1,000 cases. This is what the exponential spread looks like, and we can anticipate more cases in the coming days. Giving the same analogies again, for every 1,000 cases, we can anticipate 10% cases will be hospitalized at least for one day, meaning 100 cases will go out to the acute care hospitals in the region. And at least 2% to 3% of these cases will die. That means 20 to 30 individuals will die as a result of COVID. The cases from our community are spilling into our long-term care homes, retirement home, as well as in the agricultural farms. As of yesterday, we are dealing with 3 farm outbreaks with 21 cases and with more pending results. It is absolutely important that all these high-risk settings, please follow the public health guidelines that are applicable to them, and also any additional orders issued to them. For example, a Section 22 class order for the agricultural farms. For the residents of Windsor-Essex, it is absolutely critical that you follow the measures identified in the gray lockdown zone. More specifically, stay home, work from home, and do not have any social private gathering, since it's not permitted in the gray lockdown zone. We all need to work together to keep our community safe. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Sorry, I was just gonna put some glasses over my son. You can pass me to the next round, please.
Okay. Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Yesterday you mentioned that you were looking into other systems to tackle the case management and contact tracing with the number of cases that we've got going on. Are there any updates for that announcement?
So I did have another meeting yesterday, and I will be bringing a proposal to our board tomorrow night to get some further direction from our board. So things are moving along, but no official news quite yet.
Okay, that's everything for now. Thank you.
Any questions from AIM 800?
Teresa, I'm not sure if I'm missing it on the website, but the latest school outbreak, where is it at?
So we will be doing a media release in a little bit, and we'll update that on the website. So you're kind of hearing it a little ahead of time, but the media release is ready to go, and then we'll update our website.
I just want to make sure I'm looking at this right. The case, or the outbreak, excuse me, at Central Park Athletics, Corpus Christi, that's been rescinded now?
Yes, you're reading it right, yes.
So does that mean the cluster investigation is wrapping up as well?
Yes, we do have some more information regarding the cluster, but the outbreak has been rescinded for that particular group. But we do have more cases that we're investigating related to that.
Okay, thank you. One final one here for Dr. Ahmed. Dr. Ahmed, just in regards to the cases in hospital, right now there's 57 confirmed cases, 12 in ICU, and then the 79 suspected cases. Is that the most, I believe it is that the most we've seen in our area hospital since the beginning of the pandemic?
I think so. I'll have to go back and confirm with my epi, but my understanding is that's the highest that we have seen. And again, it's a reflection of how many active cases that we have in the community and how quickly we are getting to these cases. And as I quoted some of the data, that if we are crossing 1,000 cases in just 10 days in our community, just by the numbers, as I said, 100 people will be in the hospital in the 10 days. And then at least 20 to 25 people will die. So I think it's these numbers are, and I'm not trying to fear monger as people are sometimes say, it's just stating the facts, and it's just highlighting the magnitude of the problem that we are dealing with. And again, this is not over yet. This is ongoing. We moved from 25 days to 10 days mark. So we will expect to see more hospitalization, and there will be more deaths. And as a community, we all need to pay attention to those numbers and do our part to ensure that we're not only protecting ourselves, but everyone around us.
And I just want to make sure here, when you say suspected cases, those are individuals that have gone to the hospital that are showing symptoms and they're just awaiting a test. Is that fair to say?
Yes, I think a majority of them would be similar to that. There could be others who may have gone for any other reasons, but upon further investigation, there was a concern about COVID, and they are practically treated in the hospital as a COVID case until proven otherwise. So from a resource perspective, they take the same amount of resource because they are suspected COVID cases. And unless they get a negative, they continue to be in isolation. They continue to be in these precautions.
Okay, thank you.
Any questions from CTV?
Yes, hi, good morning. We understand that that the Ministry of Labor is investigating a complaint of a potential exposure of COVID at the Windsor Assembly Plant. Can you say at this time, is there a risk of exposure for plant workers, and what are the workers being told?
Well, not to our radar at this time. Ministry of Labor can investigate or go into many of these workplace settings without the need to notify us. So I don't have any specific details on that, and if that's happening, this would be through Ministry of Labor. We investigate all the cases that we receive, and then we notify the Ministry of Labor as appropriate. As of today, I don't have anything specific for the assembly plant at this time.
Thank you.
Any questions from CBC?
Yes, good morning to the both of you. Yesterday evening, we learned that a memo from Ontario Health that was issued to hospitals to basically asking that they prepare their emergency plans for COVID-19 patients. We have reached out on our own to some area hospitals, but in terms of the health unit, what have you heard, or have any supports been asked of you from Windsor Regional, Erie Shores, and all the hospitals in the region in terms of assistance for prepping for this suspected influx? How good of shape are we?
So we do meet once a week at least with all our health system partners to talk more about the issues in the acute care system and how public health is doing in general. And when I'm saying public health, not necessarily as an organization, but in the community. How are we doing? What are the pressure points? Where are the areas of concern that we are seeing? So we do have that opportunity to talk about it. I didn't have any specific opportunity to talk about the capacity issue at this time, but understanding that some of these conversations have been ongoing. Even a couple of weeks when the hospitals made a decision to restrict the number of visitors, we were aware because of the challenges and the pressures that the hospitals are seeing at that time, and with the high rates of community transmission that we are seeing. So that conversation is ongoing. I wouldn't say that we sat down and talked specifically about the issues. As you know, we are investigating a cluster at Windsor Regional Hospital, so our team is already in contact with them about that cluster and helping them manage this before it turns out into any outbreak. So those conversations happen at multiple levels. I wouldn't say that we specifically sat down and talked about the capacity issue. There may be some other conversation that the hospitals are having among themselves, but I don't have those details.
Okay, and I also wanted to ask about the ongoing situation of the village of St. Clair. Just wondering if any supports have been offered by the health unit to the village of St. Clair, and also are you aware if any orders were issued to them or if there's any plans to move people out of that facility?
So we have a protocol that was developed a couple of months ago, a collaborative framework for managing outbreaks in the long-term care home and retirement home, and that framework was developed in consultation with our key partners, which is the Ontario Health, the hospitals, and shared with all the long-term care home and retirement home in the region as well. And based on that, we identified number of issues, number of roles and responsibilities to address all of those issues. So the moment when an outbreak is declared, there is an outbreak team that is assembled, which constitutes the members from the health unit, which and the director of care from the facility, and infection prevention and control person from the facility, includes the affiliated hospital, and it also includes representation from Ontario Health that provides staffing support to the facility. So at that outbreak meeting, we lead that outbreak meeting by identifying, putting all those data in perspective and identifying the issues, and provide recommendation based on the cohorting, based on the needs for testing, based on the need for infection prevention and control measures. So we provide all those recommendations and guidelines to the facility, and then the facility have to implement all those measures in place. With the COVID situation, the direction from the ministry is to assign a hospital to work with these long-term care home, is try to further reinforce some of those messaging by leveraging some of the staffing and expertise that these long-term care home and facilities have to offer infection prevention and control measures, as well as any staffing needs, as well as any testing needs and cohorting guidelines. So the hospitals provide that kind of support. And then through Ontario Health, they also supplement any kind of staffing needs through whatever staffing that they have to the facility. But at the end of the day, these are the roles and responsibilities identified very clearly. We never provide any staffing support because we don't have that expertise to work in the long-term care home. We do have the expertise to manage the outbreak, and that's why we provide many of these guidance. No orders have been issued so far for St. Clair, but we have issued orders to the facility in the past in the region, at least twice, I believe. And in those orders, those were the conversation based that came out from the outbreak team. And the outbreak team, as I identified, it includes all of those key groups, and they come up with a plan. It's to make sure that what are the pressures, what we need to address on, and what we need to critically send out the message. If the outbreak team, along with all these partners in together, they have any specific pressure point that they're identifying, we all know the staffing is a challenge. We all know that the cohorting in this type of setting is a challenge. Other than that, if there's anything that can be supplemented by the order, I think that can be done, but I'm not writing an order for the sake of writing an order, just to shift my responsibility. We have to identify how we can support this facility, and if it's needed, we want to make sure that the support either is available from an outbreak perspective from the health unit, from a staffing perspective as much as possible from the hospital and the Ontario Health, but the facility itself has the ultimate responsibility to manage this outbreak from a staffing perspective, from an IPAC perspective. I think this is not right to say that nobody expected a surge, especially for the facilities that are for profit and they have other facilities in the province. Every facility should have to have a contingency plan. Where's that contingency plan? How it's being implemented? If there are gaps that needs to be supplemented by the order, that would come. But at this time, we haven't issued any order yet.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Yes, doctor, I know this is more of a question for the hospital, but I'm just wondering if you have been involved in any conversations surrounding the field hospital recently and putting that space to use based on what's going on right now.
So we didn't had any specific conversation on the field hospital, and I think it really depends on the capacity and the hospital. If they trigger that they don't have the capacity to admit patients, then I think there will be some conversation, but that conversation hasn't happened yet. I think the hospitals are managing all these cases at the two campuses and reducing some of the additional elective surgeries and other procedures. But if needed, that conversation will happen, but I haven't had any discussion specifically on the field hospital yet.
And separately, yesterday, Windsor's mayor told the Star that the city would be offering any personnel it could to the health unit. I know that was later on yesterday. Do you have any update on that? Have you had a conversation with him? And would it be feasible for the health unit to take on municipal staff to do any work?
So I will start and then I'll pass it on to Teresa. We didn't had any formal conversation with the city, and the challenge is the work that is needed. It does require some specialized training, but I'll let Teresa respond to the rest.
So we have had the warden did reach out about a week ago and basically had indicated that there were some municipal workers as well. But the work that that's putting the most pressure on our staff really is the case interviews, which requires some expertise in interviewing and knowing all the intricacies of contact management and COVID. So the groups that we have doing that work are basically experienced case and contact people or nursing staff. So I'm not sure if that expertise is out there, but I do recognize that people are wanting to help, and for us right now, it's that specialty kind of service that we're looking for.
Okay, thank you.
Any further questions from AM 800?
Dr. Arnold, we got a question here from a listener, and I'll just read it to you if you can answer this if you don't mind. But the listener is wondering, why is it not mandated that people should be working from home if they can?
I think it's already required under the letter of instructions, which has gone to all the businesses, and it's available on our website as well. And it is written there that everyone should work from home wherever possible. And I think the language around wherever possible, we don't know all the businesses. We don't know whether they have the technology, whether they have the ability. And we're hoping that the businesses and the workers are making the right call in making that determination. But from a messaging perspective, our message is clear. We want everyone to work from home as much as possible. If they don't have the means to work from home, then that's a different story. But anyone who can work from home, they should.
Okay, thank you. And one final one. I know my colleagues asked you this question and we hit the 2,000 mark, the 3,000 mark, and I believe the 4,000 mark. But when the pandemic began in March, and I know there was a lot of unknowns in March, and there still are some unknowns, but did you ever think Windsor-Essex would top 5,000 confirmed cases?
Honestly, no. And even, as we are talking about our second wave, the most cases that we have seen in our first wave was 90, but then it was kind of expected knowing the farm that we are dealing with many, many cases in that situation. Daily case counts, I think on an average, I shouldn't say on an average, I think the highest we've seen throughout the summer would be in the range of 30s and in the range of 50s. And that was the highest. Right now, 1,000 cases in 10 days, basically meaning we are averaging 100 cases. And I could never even imagined or guessed that it could be this high in our region, especially in March or even in the summer when we were seeing single-digit cases in the region. So it is unfortunate that it really increased, and I believe maybe our good numbers for some time in September and October may have given the false sense of security and an impression to the community that they're not at risk. And it resulted in transmission. And because of the widespread transmission, it is still ongoing, and it will take some time for us to contain it. And with all these measures that are currently in place, it should help. But we, with our region of our size, with this many cases and a day, it's totally unimaginable by any measures.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, just one question here. We recently spoke with Mayor Drew Dilkins, and he said that some small businesses are getting creative to stay open. He said some businesses have been putting groceries on a few of their shelves just so they can stay open there. From the health unit's perspective, what's your response when you hear that? Well, what do you think of that? And also in terms of the legality of that, what are your thoughts on that?
Well, we have to look at the specific instance, what we are dealing with. But what happens is the business licenses are granted by the municipalities based on what they do, and under the regulation, there are specific businesses that are identified and not necessarily what they sell. So if their business license identifies them as a supermarket, grocery stores, and indoor farmers market that sell groceries, then those are the facilities that can stay open. There are a number of other facilities as well, but they're all under the regulations. So it's defined by what business license they own, which is issued by the municipalities and by the province. And not by what they're selling. So I think we'll have to look deeper into each of these instances and make our recommendations. But again, some of these licensing and requirements are issued by the municipality and the province, and not by us.
Okay, thank you.
Okay, thank you, everyone.